A woman is a homemaker. A woman is a nation builder. A woman is a wife. She's a mother. Whatever you give a woman, she multiplies it and makes it bigger and better. Of course, this is not only to the abled woman, but also to the disabled woman who has told herself that against all odds, I can be who I want to be. Welcome to Against All Odds on the Nigerian Television Authority, a program that brings to your doorstep the lives of persons with disability. And of course, our focus light today is on Lois Alta, a woman who has dared disability to his face and said she is only disabled in one aspect, but every other aspect is alert and intact. She has told herself that I dare to dream and achieve everything I desire to become in life. Don't go away, stay with us as we will be right back. My name is Toshima Pius Ikerabe. Don't go away.
This is Against All Odds.
Very happy to see you here.
Thank you so much for letting us into your home.
You're welcome.
We appreciate greatly.
Yeah.
Sennupa. So you stay in this house alone?
No, I live with my adopted daughter of 4 years old. Her name is Zina. And my niece, Godia. They have all gone to school.
Okay.
Yeah.
Okay. So when they're not around, you actually move around yourself, doing things yourself?
Yes. When they are not around, I usually go to the kitchen and cook and do some house chores by myself. After all, before they joined me, I was living alone.
Really?
Yes. So most times I do my house chores by myself. It's only my clothes that I take to the dry cleaner. So Donna, you're welcome.
Good morning.
Yeah, good morning.
Good morning, sir.
Good morning.
Yeah, we're doing a documentary with NTA.
Well done.
Thank you.
Is your friend?
Yeah, he's my colleague. He's the founder of Potter's Gallery Initiative.
Okay.
Yeah, we are into development work together on the betterment of lives of persons with disabilities in Nigeria.
Wow, fantastic.
Welcome.
Okay, so what's Potter's
Potter's Gallery.
Gallery.
Okay, Potter's Gallery.
From the word potter. Potter.
Okay, you're an artist.
Yeah.
It's an arts organization run by people with disability, mostly artists, and we use arts to talk about the lives and struggles, the resilience of people with disability. We use all art forms or all genres of the arts.
Okay.
So we are about 10 years old. Through the arts, we've been able to, raise awareness about issues of people living with disabilities.
Okay. You do exhibitions and all that. Are you also an artist?
No.
Okay, okay.
Exhibitions, theater, performances, music,
That's interesting.
poetry. That is exactly what we do.
Oh, wow, that's a huge one.
Yeah.
I think we'll have to storm your gallery one of these days. So for how long have you been in Abuja? Let me get water.
Yeah.
Thank you very much for the water.
Yeah, I was here since when I was 18 years old.
Okay.
And I'm 38 now.
Wow, so that's 20 years.
Yes.
Oh. I'm sure you'd like to share your story with us. You'd like to tell us how everything happened. Okay?
Proud
Okay?
of my story.
All right. Okay, so you tell us, we'll start from the very top. So I asked, were you born like this?
No, I was born as a normal child. I was affected by polio when I was 2 years old, and I thank God for the family I was born into. They so much believed in me. They were able to send me to school. And after my secondary school, I could not go further. Even before the secondary school, when I saw myself differently from other children, inferiority complex set in, low self-esteem set in. Until my mom really talked to me. She said, Lois, you have to accept yourself. Lois, you have to thank God that you are alive. And you have to be very proud of yourself. So from that time, I began to mingle with other children, because before then, I didn't want to mingle with children in my class, my compound, my church, and anywhere I found myself. But I was able to conquer that through the help of God and my mother. So after my secondary school, I could not go further because I come from a very poor family background. So I started selling recharge card and making phone calls. And I was able to send myself back to school. I got a diploma in public administration from University of Abuja. And through the help of my classmates and passionate individuals like Mrs. Mekori, I was able to finish my diploma successfully. Then after my diploma, 11 of us were opportune to get an opportunity to do an industrial training in NNPC. And I was lucky. From that number, I was the only person that was retained as NNPC support staff, though it was not a permanent job, but it was a good one. I never knew that one of the HR officers was asking questions about me. Is she diligent in her work? Is she committed? Is she passionate? Does she come to work? And those questions were positive. So she was very proud of me. And that got me the opportunity to retain as a support staff in NNPC. So from there, I picked a form for BSc, and today I'm a graduate of public administration from University of Abuja. So from that point, I also felt very bad on a good day when I was going to work in my car. I saw a person with disability crawling by the roadside without a wheelchair. So I felt very bad. Something pricked me that what am I doing to ensure that this set of people, my friends, I call them my friends because I'm also one of them, get their rights as individuals. So I came up with an idea of Cedar Seed Foundation through the mentorship of Irene Bangwell, Donald Onanka, Dan Disin, and other persons with disabilities that I always follow their activities. Okay. So Cedar Seed came into existence from 2011 till date. So I see my disability as a bridge and not a barricade. I see it as a blessing and not a curse. And I also see my disability as an opportunity to change the world. This wheelchair is just a device that helps me move around from point A to point B. I have 99.9 abilities in me. It was only polio that is a disability that stopped me from using my legs. But I have my hands to drive. I have my hands to write proposals that will bring impact to millions of persons with disabilities. I have my brain to think of so many ideas, innovative ideas, intelligent ideas that will create a positive change in disability community. I know you're aware that we have over 25 million Nigerians with disabilities, which for too long we have been excluded, discriminated, and underrepresented in our government policies and programs. And that moved me to concluded 2019 elections. I ran for House of Representatives in Ahmad Buhari Federal Constituency on the platform of Accord Party. It will also interest you to know that out of 4,680 people that ran for House of Representatives in the 2019 elections, there were 569 women. And I was the first and the only woman with disability from that list. So God has used me to break history, to break records, and to make history in the political space. Now, persons with disabilities, women and young people are inspired by my action to plan for 2023 or subsequent elections.
Wow.
So it was a good outing. I got 2,000 plus votes for my first attempt. And from there, many opportunities kept coming. A week after election, that was February 23rd. On the election day, I felt fulfilled. I felt very proud. I felt excited voting for myself for the first time. And after the elections, I got nominated to travel to Uganda and represent persons with disabilities in politics. I was nominated by Westminster Foundation for Democracy, and that project was supported by Commonwealth. So it was a good one. And on International Women's Day that passed, my story was shared by UN Women Executive Director in New York. And my video too that they did about my story was also shown on the screen with many international observers in UN headquarters in New York. Many organizations have been inviting me to come forward and share my experience. And I have been traveling in this country and internationally sharing my ideas. It will also interest you to know that I am the first Black woman with disability from Africa that was named a young global leader of the World Economic Forum in 2017. I am an Ashoka Changemaker Scholar. I am a Mandela Washington Fellow, where 500 youths were selected from sub-Saharan Africa in 2014, and I was one of them. We traveled to the US. We were trained on leadership skills at the best universities. I was at Arizona State University for 2 months. Then we had a presidential summit in Washington, D.C., where we met global leaders like former President Obama and his wife. I got a handshake from him and a hug from Michelle Obama. Michelle told me to my ears that she's very proud of me. So you could see that disability is just a word. It can never stop me from becoming who I want to be. It can never stop me from achieving my dreams. And by my own concept, I changed the DIS to THIS. That is disability, not disability.
Wow, you've been able to achieve so much, and I'm sure when you look back, you'll just be grateful to God that He actually put all those ideas into you to be able to help humanity, which you're still doing. And I'm sure you still have the intention to go further. This ability definitely has a future, okay?
Yeah.
So you would like to share with us your dreams, what you need, what you still desire to aspire?
Yes. I have plans to run for an office again in 2023. Yeah, Mr. President tried 3 times before he got it. So I will also plan for 2023. And for my personal life, I'm also planning to set up a family where I will have my own kids and train them to become great leaders more than me. Yeah, and in my organization, I plan to see in the next 10 years, I want to see buildings being accessible to persons with disabilities. That's our infrastructural buildings. Should have ramps, our schools, our offices, our parks and gardens, our social centers should be accessible to persons with disabilities. Information too, that's ICT, should also be accessible for the hearing impaired. A percentage should be reserved for graduates with disabilities. And when we talk about our transport systems, are they really accessible?
Are they disability friendly?
Yes, are they disability friendly? And so many issues. Our educational systems are not inclusive. If I had attended a special education, I wouldn't be here today. That's the truth. Because the way they teach children in special schools is different from the way they teach children in the other schools. So I want to see our educational system being mainstreamed and inclusive.
You did mention you actually have an adopted baby girl,
Yeah.
and your cousin, and then now you've mentioned you're ready to raise a family. That's actually going private, yes, but are we expecting that anytime soon?
Yes.
Maybe you just want to dive into that a little.
Yes, by God's grace, I'm in a serious relationship. And very soon I will send invitation.
Wow, I cannot wait to be part of that.
Yeah, thank you.
I cannot wait. Because me and you personally will have a dance.
Yes, sir.
Okay.
Yeah.
So what actually spurred you into adopting a child?
I lost my only sister to cancer in 2016. And before she died, she was married with a child. She left her at 12 months old. And the family, both her husband's family and my family, decided to say, okay, Lois, you can do this. And even before then, she wrote a letter and kept it under my pillow that if anything happened to her, she wants her baby to remain with me and I should train her till she grows up. So that was what happened. I could not say no when we finally lost her, when she passed on January 1st, 2016. I come from a Christian home. My mom was a godly woman. But though I lost them, I lost my mom in 2011 and my dad in 2014. They were my backbone. They were my backbone when they were alive through the advice, the mentorship, the support, and so many things. My mom is my role model. So she gave birth to, my mom and dad gave birth to 11 children, though we lost 5. Now we are 6. And the 6, I'm the only lady with 5 brothers.
So in life, there are challenges.
Yeah.
Even the normal person who thinks is able has a lot of challenges. Would you like to share your challenges with us?
Yes, we have challenges of discrimination, marginalization, stigmatization, and stereotyping. Yes, discrimination in the sense that the general public see us as people that need pity. We are treated as second-class citizens. That is why we call it the charity model. Instead of government advocating for our rights to be given to us as citizens, you will see that even government is doing a program for us. They prefer to do it on a charity level by saying, okay, they need food to eat. So they start by sharing bags of rice or some other stuffs that will not last us longer. Yeah. So the discrimination is much. We need to move from charity model to human rights model. The human rights model is what will give us our rights as citizens first. They see us as people first before the challenge. That is human rights model. They try to provide employment for us. They ensure the transport system are disabled friendly. Our infrastructures too are accessible to us. Our economic development is also inclusive. We have rights to banking halls, to have access to banking halls. We have rights to education, rights to employment, rights to transport, rights to economic development. Do you know that as a person with disability, we can contribute 7% of Nigerians' GDP?
Yeah.
If we are given the opportunity and the support. So we are productive. We have the potentials. We have the rights and the gifts. We have the talents to become great leaders. We can have citizens with disabilities that are senators, House of Reps, House of Assembly members, even presidents. We can achieve it. US had a president with disability, and it was during his time that he changed so many things in US that today US citizens are enjoying.
It's a great achievement because there are some people that cannot drive to Nasarawa. Yeah. You know, they're scared of the highway and all that. Everything in life has to do with determination.
Yes, sure.
Just believe you can do it. Wow, well done. Thank you very much. Your story has been so inspiring.
Thank you.
And I know that it will inspire a lot of people out there who will wake up today and say, if Lois can do it, then I can do it. Thank you so much for giving us your time. Thank you for staying with us on Against All Odds. What have they said to you? What has been your story? Did that self-esteem, low esteem happen to you? Did you tell yourself you're not capable or, you're not just worthy to be among them? It is all about you. To dissuade it, to tell yourself, Even though I have found myself in this situation, I can make the best use of it. Talking to Lois today, being part of her life, has encouraged me greatly, and I hope it has done same to you. This is a challenge thrown to you. Wake up, pick up that challenge, and make yourself proud. Let's do this again. Next week, same time. My name, Toshima Pius Ikerafe. Bye.
Information is power. Everyone wants power. So feel powerful with the NTA News mobile app, the one-stop information center. Real news at your fingertip. Be the first to report by uploading first-hand information on the YouReport link, and be the first to know by simply clicking on any of the links on the sidebar for headlines, domestic and foreign news, economy, security, politics, sports, and more. Stream live on your smartphone and tablets and stay connected. It's pretty easy. Simply download NTA News app from your Google Play Store and you're good to go. NTA News mobile app, your access to real-time information.
Yes. One day as I did dab, they go. Now I see my neighbor on top electric pole. Don't be how my hold so.
Before, so
Climb every day. Come on, electric bill. You not gree pay.
waiting concern you for there. I beg you, come over here.
Okay, oh. I don't talk my own. As I dab reach house. Yay! Fire! Fire! My brand new flat screen.
Hold up.
Waiting concern you for there. I beg you, come over here.
Government property, now my property. If you don't come down now, I go report.
No be only report. Now report card.
Dab, 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 dab. Yes.
Imagine a station where you access information. Think of a station that creates awareness for national development. Imagine a station that prepares you for a bright and greater future. A station for all ages. Documentaries, classroom and television, events coverage, children's programs and variety shows. Always stay tuned to NTA Knowledge on the StarTimes platform, channel 359. For partnership, sponsorship and advert placements, contact us on NTA Knowledge. NTA Knowledge, learning to broaden horizon.
This is the network service of the NTA.
Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. And as you know, we've been focusing on the health of the Nigerian, the health of the black person by extension, but the health of the Nigerian. As we know, there are several issues that concern us as Nigerians, especially cardiovascular disorders, brain issues, diabetes, sickle cell disease, and a few others. And a lot of credit to the government, the Ministry of Health, and other organizations, and the NTA and other organizations, and we're trying to raise awareness and bring these issues to light, especially when it comes to you, the individual. You need to know what to do to take control of your health, and you need to know what to avoid so that you don't fall into many of the health pitfalls that many people fall into these days. So today we have a very special guest and a very special topic, and I think it's gaining importance as we go along, and that topic is patient safety. And with me on the platform, with me on this on the stage, is a very dear friend whom I've known for a long time, but who is extremely passionate about patient safety and healthcare in Nigeria as a whole. And her name is pharmacist Estelle Mbadiwe. Did I get that right?
Yes, you did.
Thank you so much for joining us on the show today.
Thank you very much for inviting me.
And she is, let me get this, I'm sure I got this right. I hope I get this right. Dusit Blue Solutions.
Yes.
Awesome. What is that about?
So Dusit Blue Solutions is a healthcare consultancy company, and our focus is on improving the quality of healthcare, providing solutions and strategies to improve patient safety and improve quality of healthcare. So we do that by working with both the government and facilities directly.
Facilities as in hospitals?
Hospitals, health.
Okay.
Yes.
Okay.
Yes.
And so the government, so you act like as a consultant with the government to emphasize these issues that you're concerned about. And I'm assuming that you're bringing in a lot of these principles and these practices from your experience as a pharmacist in the UK.
Yes, my experience as a pharmacist and also my experience in health policy, planning and financing, and as a consultant working on change management and behavioral change to try and institutionalize some of these solutions. So we're trying to bring global best practice and localize it, obviously, for the unique environment in Nigeria. So it's not just a copy and paste, it's localizing the solution so that it fits with the need of the Nigerian environment and the Nigerian patients.
That's a tall order.
Yes.
I'm sure you have your work cut out for you.
Yes. We collaborate with a lot of people, and it's really important to work with what is in the system, what is in place, to embed this into what's in place to improve the chances of getting a successful outcome.
Got it. Patient safety, what's that about? Why should we care?
Why should we care? So patient safety, we should all care because healthcare is something that you can pick and choose when you need it. Obviously, like you mentioned earlier, there's a lot of chronic conditions, cardiovascular conditions, which are more long-term, but also there are also emergency need for healthcare. So if we don't care about improving the safety of the healthcare that we deliver, like I said, you can't pick and choose. So if we don't institutionalize patient safety, the outcomes will be very poor. We already have quite poor health indices in the country. So we need to make sure that the care that we're delivering to the patient is safe and of as good quality as is possible.
And I agree with you. I think you and I were talking about some of the issues that have come up in the past. And in my case, because we deal with children in our foundation, and we've had instances in which, I'm not going to mention names, but in one of the hospitals in Nigeria, in Abuja here, a child with diabetes, what you call it, type 1 diabetes, insulin dependent. So the parents took her to the hospital. She was supposed to have a certain level, I think it was a small percentage of insulin that was supposed to be injected to her on a daily basis. And the nurse at that time, and this is what the parents said, the nurse told them instead of 0.3%, they said they gave up to 30%. 30 mils. 30
milligrams.
And of course, That's 100%, 100 times, not 100%, 100 times what the child was supposed to have, and instantly, as you can imagine what happened. Instantly went into seizures, coma, and was paralyzed. And in fact, when they brought him extended, in other words, but basically they were advised that it's,
unfortunately, cases like this, do they have a system where they're doing root cause analysis?
Train. Have you got into any hospitals to kind of train, offer to train their staff on these things?
Yeah, so basically the hospitals, they definitely have some training that they do, an induction for the staff, but with healthcare, it needs to be dynamic. You need to review, is it appropriate for global best practice to ensure that you're delivering the best care to your patient.
Right.
So this is something that needs to be reviewed currently with what is happening globally. The world is moving very fast, and we need to make sure that Nigeria and the health facilities in Nigeria are moving in that pace, because we lose approximately $1 billion annually to health tourism.
Who?
Nigeria.
Nigeria.
Yes. $1 billion approximately to health tourism. So this is money that is lost that could obviously be invested back into our health sector.
Wow.
We lose not just patients going for medical tourism. We're obviously having a huge amount of brain drain with doctors, etc., healthcare professionals leaving the country. So if we think of how much people are willing to spend, $1 billion annually, approximately, we need to build the trust in the system. This is, most of the time, is lack of trust in the system that leads to people, leaving to get sometimes the most basic healthcare.
I think you've touched on a very important point there, this lack of trust thing. But seriously, we're going to jump into that thoughts, because is it just about patient safety? Are there other issues where we need to be concerned about? But let's hold that thought for now, and then we'll get back into that in a few minutes. So stay tuned, folks. What do you call it again?
These days, people get their news and information from more media sources than ever before. Some of the news and information given are fake, unverified, doctored, and manufactured to create confusion, stir disaffection, and cause disunity. Before you believe or share any news, ask yourself, is this real? Is it from a credible source? Is it verified or verifiable? Fake news is dangerous. Whether you do it for fun or for political gains, real people can get hurt. Fake news, don't create it, don't spread it.
This is a public service announcement from NTA.
Today's growing trend is the beard. This facial hairstyle is common amongst the youth and the middle age all over the world. What is fashionable about the beard?
It's just a personal thing, it's going to the barbing salon.
It can depend on one's choice to such as, in as much as it is well.
Title holder, so I go and maybe say, have to say Dobale, Chief Mary Onyali, welcome.